one question I often get. So, Miss Adetutu, I'm told that I still need a pap smear even though I'm not sexually active. Why is that? Today, I'm gonna break that down, including very common myths about pap smears. Hi, my name is Adetutu and I am a board-certified women's health nurse practitioner. And today, we are going to talk about pap smears. Let's get into it. Okay, so first, pap smears. We have heard so many things about pap smears. I feel like when I was younger, I heard more about pap smears than any other thing. You need to get your pap smear. You need to do this, you need to do that. But it seems as if a lot of us still do not know the reason why we get a pap smear. So I'm gonna break that down really quick. So pap smears are to check for abnormal cells in your cervix, okay, which can lead to cervical cancer. So, quick facts about pap smears. Prior to pap smears, cervical cancer was the leading cause of death in women. And due to pap smears, cervical cancer deaths have decreased by an alarming rate. As a matter of fact, cervical cancer deaths are less than 1% of all cancer deaths. So it is a big change, and it's very important for us as women to get our pap smears. Okay, so you may be thinking, all right, so with this pap smear, what exactly are you guys looking for? All right, so we're looking for several things. We're looking for abnormal changes in your cells, right? A normal cervix is usually nice, pink, and plump. Okay. Now, if you start having changes in your cells, your cervix may start to look differently. However, sometimes it can look completely normal and there can still be some changes that are not seen yet. All right. Which is where the pap smear comes into play. Now, with the pap smear, we are just swabbing to get some samples of the tissue, sending it off to lab, and we are checking to see if there are abnormal changes in the cells. And for this big thing, HPV. Human papillomavirus. Say that 10 times. Just call it HPV. So HPV is a virus. It is the most common sexually transmitted infection, okay? So pretty much what it does is it can cause these changes in your cervix, right? And if it's not caught very early on, it can cause cervical cancer, okay? So what do you need to know about HPV? All right, so there are different strains of this viruses, but there are specific kinds that cause cervical cancer, primarily HPV 16 and HPV 18. These are the ones that are known to turn into cervical cancer, okay? So with these pap smears, when we are checking this, what happens is we are checking to see if you have HPV, and if you do, what kind it is, what kind of strain it is, and what kind of changes have already happened to your cells, okay? And based on that, it'll determine how often you should be checking your cervix to see, are these changes getting any better? Is it decreasing? Did the HPV go away? Because HPV goes away usually goes away on its own within a few years. With good diet, with exercising, with not smoking, okay? I'm gonna repeat that because that's a very big thing with not smoking. Smoking is known to keep HPV infection in the body, all right? And smoking is actually known to cause HPV to turn into cervical cancer. So it's very important, we know, to not smoke, right? So with this information, here's a lot of things that a lot of my girls would say once I educate them on this. Well, Miss Adetutu, since HPV is from sexual activities and I'm not doing that, can I skip this pap smear? And I always say, we know that HPV is the most common cause of cervical cancer, right? However, there are still other causes of cervical cancer. Now, there are things such as smoking, long-term birth control use, okay? Family history as well. Having a weakened immune system, okay? Having a diet low in fruits and vegetables. Yeah, you heard me. Diet and lifestyle is still very important when it comes to all cancers, okay? Fruits and vegetables go a long way. They have antioxidants, they have vitamins that literally work to regenerate our body and prevent things like cancer from happening. Eat your fruits and vegetables, ladies and gentlemen. So things like that can make a woman more predisposed to having cervical cancer. So that leaves us to the answer. Even if you're not sexually active, pap smears are very important, okay? And pap smears start at age 21. So you turn 21 and this is your gift to yourself and your health, okay? You get your pap smear, and based on what the results are, let's say HPV was detected, then you would need to be monitored sooner, right? But let's say everything was fine and your results were normal, then the protocol, the guideline is every 3 years. And then based on your age, once you turn 30, and based on the type of test actually that you get, because there are 2 different tests. You can do the changes in your cells by itself, or we can check for HPV and the changes, okay? So based on whichever test you get, you can even prolong your pap smear to up to 5 years. Discuss with your primary care providers about your routine. And then if you say, you know what, I want to get a pap smear every year because I'm highly anxious, I'm not sure, I don't even know my family history, as a lot of us really don't, and I want to get a pap smear, should I not be allowed based on the guidelines? You can speak to your provider about this, and it is your right if you want to get yearly pap smears. I get this question a lot from a lot of my patients. Can I get yearly pap smears? And absolutely, discuss it with your primary care provider. I know a lot of providers, that is their practice. They do yearly pap smears just to be on the safe side. Oh, and another thing to clear up, okay? So I'm a virgin. Will pap smears break my hymen? Does it mean that I'm no longer a virgin? Pap smear does not disrupt this at all. Okay, this is a big misconception. It is a small plastic, okay, and it should be done very gently. So please put your mind at rest and speak to your provider honestly about using the very smallest speculum and being very gentle. Okay, so now let's bust some myths. The first one, we've already covered it. If I don't have sex, I don't need a pap smear. That is a myth, and we already know why. Myth number 2, well, I'm not having any symptoms, right? I'm not seeing any warts because HPV causes warts as well. I'm not seeing any changes in my body. Things don't feel differently. Do I still need a pap smear? Actually, pap smears are most important to catch any changes before the symptoms come about. When it comes to cervical cancer, a lot of times the symptoms come on when it is so far gone. So you want to catch any changes in your cells in hopes of getting treatment, getting it removed before it turns into cervical cancer. Another myth, pap smears test for all STDs. Since you're already down there, shouldn't that just let me know about all STDs? So it mainly tests for HPV. Now, oftentimes you can catch like chlamydia or gonorrhea or BV or yeast infection, but it's not always guaranteed. So it's very important for you to get those tested separately, okay? Through a urine test, through a blood test. Okay, so that was just a quick review about the importance of pap smears. Here's what you really need to know. Once you turn 21, no matter what, you need to get your pap smears regularly. It is extremely important for your health. If you have any questions about pap smears, you can leave a comment down below. We can talk about your experiences. I talk all day with my girls about how gentle a provider should be and how you can coach your provider into being gentle, telling them, can you please use a smaller speculum? Can you please tell me when you're about to do this? Unfortunately, a lot of women's experience with pap smears causes them to stop getting pap smears regularly, and I don't want that for you. So if that is your case, please, I am asking you to guide your provider and saying, please use a smaller speculum. Please go gently and slowly. Please use lubricant and things of that nature. I hope this video was helpful to you. Send this to someone who has questions about pap smears. Thank you so very much for watching. I'll see you next time. Don't forget to like and subscribe. I'll see you next time. Bye.